Okay, so we're going to be looking at some knee evaluations. The first thing you want to look at is comparing the knees bilaterally. Just that way you can see any sort of swelling, edema, ecchymosis, any sort of bony deformities that may have happened. Another thing you're going to want to do is have your patient or your athlete just take some steps down the hall and back so you can see if there's uh, any differences in their gait and how they're walking. We look all the way down and back. Okay, so you're going to want to look at the Ottawa ankle rules too. These are indications that with knee injuries, you're going to want to have an immediate referral for X-rays, and that's if your patient or athlete is over 55 years old, if they have any isolated pain at the patella, any pain at the head of the fibula, or they have any issues bending to 90 degrees, or if they can't take 4 steps after the injury or during the evaluation as well. Okay, so we'll move on to palpations. And you can sit down first. Okay, so the first thing you're going to want to do is palpate any bony landmarks like the head of the fibula, the tibial tuberosity. You're going to want to feel for any swelling, any tenderness anywhere. You're also going to want to go up the lateral side of the thigh too. This way you can palpate the IT band as well, because that inserts right at your knee as well. So other landmarks that you want to palpate are your the tibial tuberosity. You're also going to want to palpate the patella. You can see any swelling or any edema that's going on. You can do bilateral patellar tests. So what you do is squeeze the patella, and you want to push right in the middle of the patella. And if you see any pitting, that's an indication of edema. You can also do a sweep test, and that's when all you do is just take your hand and you just sweep the outside of the lateral side of the patella or the medial side, and when you do the sweep, it'll push the fluid away from the area, and you can see the indent from where your hand was. You also want to palpate the patellar tendon. That comes down and inserts in the tibial tuberosity. If there's any pain and tenderness here, that could be an indication of Osgood-Schlatters. That's usually more prominent in adolescents. If you have any pain right on top of the kneecap with the youth, that's a sign of Sinding-Larsen-Johansson's disease. You also want to palpate the lateral side of the knee and feel for the lateral collateral ligament. It feels really ropey, like it's almost like feels like a pencil. You also want to palpate the medial side for the MCL, and that runs just down from the head of the femur. Sorry, the head of the femur down to the pes anserine, just on the medial side of the knee. You also want to palpate right at the joint line. If they have any pain medial or laterally at the joint line, that can be an indication of a meniscal tear or strain. So then you want to go into range of motion. You're going to have your athlete first do what they can on their own, doing any flexion or extension for their active range of motion. Then you want to follow that with your passive range of motion as well. And if you don't have, if you don't have the right space, you can have your athlete or patient lay on the floor, and you can do full knee flexion that way as well. So then with resistive range of motion, you're just going to hold them in place and have them press against you. So extend your leg. All right, you're going to give them some resistance. All right, and flexion. All right, I'm going to do manual muscle tests. So you're going to hold them in a flex position, and you're going to want them to not break out of this position. So you hold yourself in that place. All right. All right, and same, I'm going to try to extend your leg. Don't let me break out of this position. All right, good. Okay, so now we're testing ligaments. Some of the special tests, we're testing the MCL and the LCL. So what you're going to want to do is give them, when you're testing the MCL, you want to put a valgus stress on it. So you're going to bend the knee just a little, about 20 degrees. And you're going to stabilize the lateral part of the femur. And you're just going to apply a valgus force just to stress the MCL, see if there's any pain or laxity in that. And do the opposite for LCL test. It's going to stabilize the femur. And you're going to put a varus stress on it and look for any pain or laxity in LCL. So moving to ACL test. This is Lockman's. So just going to have the knee bent 20 degrees. You're going to stabilize just above the knee. And you're just going to apply a force anteriorly. And this is like the ACL test. So if there's any laxity, it's a strong indication of an ACL tear. Another ACL test is the anterior drawer. So you're going to have the knee bent at 90 degrees. They can do this sitting down, or they can be lying on the ground as long as the knee's bent to 90 degrees. And you just apply that same anterior force. And an ACL tear will show a strong laxity in that as well. Okay, you can